All righty, good afternoon, and thank you everyone for tuning in today for a special session here at the African American Chamber of Commerce. My name is Jordan Ivory. I'm the program director, and I am joined today by Dr. Camille Jones. We are super excited to talk to you today about reopening, safe ways and practices, and a bunch of other things. I'm telling you, these questions are off the chain, guys. Truly, we have to have these conversations. And as we were talking offline beforehand, we were talking about as I am now more aware and educated, I am definitely more fearful. However, I'm more educated. So now I know the steps and measures. So we are excited to have Dr. Camille Jones in the building today. I'm not going to read her bio, so I'm going to turn it over to her to tell you about herself, and then we're going to jump into these questions.
All righty. Thank you very much for inviting me to talk. My name's Camille Jones. I'm a physician and boarded in internal medicine and preventive medicine. I was most recently Assistant Health Commissioner for the Cincinnati Health Department and also Division Director for the Community Health and Environmental Health Services Division, which includes the groups that will be helping businesses reopen, the Environmental Health Division. And so basically that's what it is. I've been looking at all the things that have been coming out around the COVID-19 pandemic. We're reopening now. I want to say we're reopening, but the virus has not gone away. And so the safety plan for businesses is going to be very important.
Yes, ma'am. Truly, truly. We are blessed to have you in our tribe at the African American Chamber of Commerce. We met at some of my first programs ever at the African American Chamber. You've been a constant support of what we're doing, and you have been a true advocate for educating everyone at the chamber. And I know in your circles about all of the things that were happening even pre-official COVID, right? I made the joke, and I said I was going to say it today too, is that you were the first one to tell us, no elbow bumps, no fist bumps, no high fives, toe taps, And so Eric Kearney, our president and CEO, and I joke about that still to this day because it was true. And you had already told us how rapidly this was going to spread. And as soon as testing was available, the numbers were going to show. So I really appreciate you helping us kind of navigate this virtual space. So let's dive in because I don't want to bore the people with our random what we've got going at the chamber. We got to talk about this reopening. So is it truly safe to reopen?
And this is a question because we know the virus is still out there. And so there's guidances that have been prepared by the Ohio Department of Health to make it as safe as possible. And so those guidances are things that businesses in different sectors need to look at to see what are the mandatory and what are the best practice recommendations for each sector of business. But you're going to have to be very careful. You're going to have to make sure that you're following all the basic things, the physical distancing between staff and clients, the hand washing, the availability of sanitizer, use of masks and personal protective equipment. Basically, you have to be very rigorous about this in order to make it as safe as possible.
And I like that, as safe as possible, and I think that worry of that in between, like what's happening, but we have to know how this virus is spreading. We have to educate ourselves on how this virus is spreading. So can you talk to us about like the spreading of this?
Yes, when it first started, people thought that it was just spreading through droplets. So, how sometimes people talk and they spit when they're talking and, that sort of thing, or small, droplets. But we know now that the virus can also be suspended in an aerosol. And so even if people are just talking or just singing or just laughing or coughing and sneezing and all those things, all of those can generate both the droplets, which can fall, generally fall before 6 feet, and the aerosol that can be suspended in the air for up to 6 hours. And so, the things that you have to be careful about is maintaining the 6 foot difference so that you're decreasing the risk of getting someone's droplets. but also looking at the ventilation in your indoor space to try to make sure that you're not concentrating aerosol.
Right. You know, that in the air, you know, the that aerosol, you know, it's scary, you know, and so even more as we are open, you know, people I think sometimes think that the virus is just gone, and unfortunately, media isn't covering it the way that they once were, and so people, you know, are, I'm sure, you know, not practicing. I've seen it not practiced in the right format. So how long do you think that the virus like could be here?
The virus is going to be here until we have everybody has been infected or we have an effective vaccine, because this is a new virus. Nobody's been exposed to it, and everybody is susceptible, and it's very contagious. And so it's the sort of thing where we know it's going to be here probably for at least 18 to 24 months. We know in Ohio, even though we're reopening, it's not that the virus number of cases per day went up and then dropped. It went up and now it's steady. So we know the virus is still here, and as we open up, there's going to be acceleration of spread.
Yeah. So let's talk about that second wave. You know, as people are going back to work, as things are opening back up, as people have all of this money that they want to spend at all these awesome spaces, you know, and we've been locked inside for so long. How do you think things are going to be? Do you think that there will be that full second wave?
I'm really very, very frightened about that. That keeps me up at night. We know that you know, when I go out, I wear a mask. I see very few other people wearing masks, and I'm going out just for the exercise. People are telling me, well, I think it was overblown. They said that there was this number of cases and we didn't have that number of cases. That's because the public health interventions worked. It's not because the virus wasn't there, it's because the public health interventions worked. And I have friends who are doctors in New York and in Boston, and they were just telling me about all the horrendous stories about how the virus is spreading and infecting people. And you know, people have, a lot of folks have personal experience with loss from this virus, and it's real. And you know, so yes, there probably will be a second wave. We're actually seeing in the States right now increasing numbers of cases per day based on the timing of Memorial Day, when people ran out and basically said, we're free, you know. It's also scary because people are legitimately protesting against police brutality and excessive force and all these things. But anytime that you bring people together, you're going to increase the risk of transmission if one person is infected.
Right.
And one other thing I want to say, the risk of a transmission, if you have increased time associated with an infected person, and really 15 minutes or more is considered a contact, you know, something that has to be traced. You know, if you're increased time, close distance, and viral load. What we're really sad about is that there's evidence that people can have a high viral load before they develop symptoms. And so your friends who would never hurt you in the world get out with you because everybody just feels great and you're partying and all the virus is gone. And then 2 days later, they're calling you up saying, man, I feel so sick. But it's too late for you then. Right. Because you weren't wearing a mask, they weren't wearing a mask, and people are infected now.
Right. Wow. And, you know, people have to take this serious. So let's dive into the business aspect of this. You know, I feel like that was, as I was diving through our notes, I was like, oh man, this stuff is scary. You know, and we have to be proactive about being safe for others and for ourselves. And that second wave, unfortunately, because we see it, we see these people not practicing these rules, you know, and so we know what it's going to be. So let's talk about how we can decrease the spread of COVID-19 in your business. So small businesses, big businesses, I know that a lot of us are, even at the chamber, talking about our PPE products, if we're coming back into the office, but more so now we're opening the office. It will not be open to the public, but to staff to come back in and utilize your workspace. We're having it deep cleaned, and we have the ability to still work virtual. And I think that that is like, as our president and CEO said that today, I was like, that is the most amazing thing ever, to be able to work still virtual or be able to come in and be in the physical space. And so COVID is changing us. So how can businesses decrease the spread of this?
The first thing I would say by sector is to actually go and look at the guidances that have been developed by the Ohio Department of Health, and that's in the resource document that I sent. But, the things are distance, try to keep at least 6 feet distance between staff members and between staff and clients, trying to, if you can allow people to work remotely, letting them do that, but many businesses can't. I'm sorry, and, if I was out in my mask, I would not be doing this.
Sure.
To encourage frequent hand washing. And it's like, I saw a cartoon that asked some guy, what did you do in 2020? And he said, basically washed my hands. But,
Right.
Everything. Wash your hands before eating, wash your hands before and after going to the bathroom, wash your hands, when you touch high contact surfaces like doorknobs and counters and that sort of thing. Wash your hands basically, if you smoke a cigarette, which I do not encourage because smoking is bad, but if you do, you got to wash your hands because you've been putting your hands near your mouth, and you don't want, if you're an asymptomatic or a pre-symptomatic positive, to be spreading it all around the office. There's a lot of different things that you need to do. You have to actually think about queuing of people. How are you going to move people through your building? You actually have to do a hazard analysis, because if you're in a building that's multiple floors, but people are all crowding into the elevator to get up to your business. Think about how are you going to do that? Maybe you have to stagger people so that people are coming in at times when there's not going to be a lot of crowding around entrances and exits. It's all kinds of different things to control the distance between people, the time that they're close, and to control, the possibility of infection. You also will need to be looking at your ventilation systems, because if when we talk about the aerosol, you're gonna need to increase more outdoor air coming into your systems. You may also have to increase the ventilation because you're going to be doing a whole lot more cleaning with disinfectants, and so you're going to have solvents in the air too. So you're going to have to be thinking about how am I going to manage the ventilation systems in my office. You have to think, if you haven't been in the office for a couple of months, you even have to think about water. Water systems, like have to flush your systems, just to make sure you don't have lead in your water. Worry about if you have stagnant water. Legionella, is it possible? Did you have water intrusion while you were gone and have mold building up somewhere because you've been gone and you actually didn't see it? So you're going to have to do a pre-opening inspection, a hazard analysis in your office space, and then start thinking about what things can we put in place, to sort of help and keep the distance separate. Even things like increasing your online sales, decreasing the need for face-to-face contact with your customers.
Can you give us some tips on what things business owners and employees as well have to think about as they plan to reopen? I think you gave some great points in there in terms of looking at all these systems, but even the workflow, the copy machine.
Yes.
And you said something earlier about the cigarette to the mouth and then back in. Although your mask is up, to put it bluntly, your mouth is on your hands, so then you have to wash your hands, right? And wow, there's just a lot of different aspects of ways that it's almost like being in a kitchen in the cross-contamination concept, right?
Yeah. Yes. Well, this is the thing. People may have to control what used to be very nice common areas where people could congregate and socialize. You're going to have to control that. You may have to stop it. Things like the coffee maker, the vending machines, the ice machine, all those things. You're going to have to do a hazard analysis and figure out if you're keeping it open, it's going to have to be cleaned frequently. And frequent cleaning is, it could be after each use, or it could be at least once an hour. These are the sorts of things you have to think about. What can we have, and how do we keep people safe? One recommendation is no more communal meals, no buffets, everybody, potluck, don't do it.
Right. Wow. From an event experience standpoint, COVID has been very, very frightening. And I know I said it earlier, and I'm going to toot the horn again. You truly helped us navigate taking things virtual. You were one of the first individuals to tell me I had to take it to Zoom. Had I looked at Zoom? And, we've done over 40 programs virtually to date. And I want to say our programming has not missed a beat. We're still on track to do over 200 programs this year, and we're able to expand what we were doing. And if I really had to think back, and I didn't say this earlier, you were already pushing me to try to do virtual programs as well, so that you could be at programs when you couldn't physically be at the chamber, or so you could see the replay of it too. So I appreciate you continuing to push us to be greater, and we're here. Now, the resource guide that we are referencing is inside of the caption format of us here on YouTube. You may also visit our website, and it is also listed in the caption. And if you visit our website, we will have the resource document there, but there are also live links in the bio in the caption here. So please be sure to check those out. And if you need anything, please make sure that you that you check out the information listed below. We're not done, just a little bit of housekeeping, okay? I want to make sure that we dive into some more of this great things, because go ahead, I'm sorry.
Just one thing, that in the resources, there's 2 pages. One of them is actually the dashboards. So there's both the Ohio dashboard and the City of Cincinnati dashboard, which you can look at to see the trend of cases and hospitalizations and that sort of thing. And so that will give you an early clue. If you're starting to see things trending up, then you're like, better be careful. The other thing is documents and links to different organizations that have put together very complete information about reopening. So first you have to look at the ODH site for the sector-specific reopening, because that's law. But then look at some of the other resources that are listed there. Particularly, I think the CDC toolkit on reopening would be very, very useful to look at even first. And then there's some other things that I put in there that might be useful, to just give you some ideas. What haven't I thought of? What else could I do?
Sure. Now, our next question is, what interactions should you have with your local health department? And I think that this is an awesome question, because I think a lot of businesses don't always think about the health department in that kind of aspect. I don't think that they're, or always want them in their space. So how do businesses navigate working with the health department?
Now, there's three areas where you might be working with the health department. The first one is, as you're developing your safety plan, you're going to look at the ODH guidance for what is law, but you can call the health department and say, this is sort of what I'm thinking. Does this seem to be on the right track? That sort of thing. In Cincinnati, the health department is doing enforcement on a complaints-based system primarily. And so that means that if there's a complaint that comes in either from customers or staff saying, the owner's not providing the sanitizer or the PPE, that's needed to do this work, or there's other issues that may be coming up, then the health department will go and do a on-site investigation. But also, the health department is planning to look at neighborhoods that are very intensely affected by numbers of cases, and then going to the businesses in those neighborhoods to do some more targeted evaluation and instruction or education for those businesses if it looks like they're not quite doing the right thing. The third thing, though, is that, or the fourth thing is contact tracing, because we expect a second wave, And I can tell you that when we were planning for pandemic flu in the past, we were saying there might be a time where as many as 30% of staff might be out with the flu. And this virus is as infectious or more infectious than the flu. And so, you're probably going to have an employee who is either sick, they call in sick, or they become sick at work and have to be immediately sent home. Well, you're going to send them home, you're going to tell them, call your health professional. But also, if you suspect COVID based on their symptoms, you're going to notify the health department about that. And so there's going to be that interaction, because the way that we stop the devastation from COVID is you identify cases fast, you test them, you identify them, you isolate them, and then you do contact tracing for any contacts. Have those people self-quarantine so that there's not continuing spread and transmission in the community.
Wow. Yeah. It's scary. It's a brave new world out there, and we have to take this seriously, and we have to, especially in our community, we have to take this seriously. The education on reopening is so important. And the resource guide the resource items that we have are truly phenomenal. So please make sure that you check those out. The CDC has a great toolkit. That toolkit is really good. So, make sure that you check those out. Now, before we wrap up, tell me the top 3 things, and this is not in our notes. Tell us the top 3 things that businesses have to do right now as they are reopening and planning to reopen. Give us a recap of all the things that we just talked about. Give us the top 3.
You have to keep people distant. You have to protect people from respiratory secretions and aerosols. You have to do frequent disinfection with an effective disinfectant, because those are the things that are going to decrease the contact with the virus. That's the most important thing. All employees are required to wear masks or facial coverings unless there's a medical reason or one of, there are about 6 specific reasons why they would not. But if you have an employee who's not wearing a mask, you have to be able to justify why they're not wearing a mask. But you should also encourage all customers and clients and supply people, everybody, don't let them in without a mask, because the reason, most masks are keeping somebody's secretions from reaching you. So it's protecting you. Don't let them in without a mask. The other thing I want to say is that African Americans, our population has been very heavily hit by the coronavirus. And we also have more severe disease when infected. A higher proportion of African Americans who are infected to date have been hospitalized or have passed. It's very important that you're trying to protect yourself and your customers. You don't want to be the vector that's causing this virus to keep going in the community.
Yes, truly. This has been phenomenal. This has truly been great. I can't thank you enough for this information. As we are gearing to open back up to staff at the chamber, it's scary. And I know I've said that several times today. But we have to be adamant about maintaining what we are and what we're doing and making sure that we're taking the necessary steps. And we can't get lazy, because if we get lazy, we're going to get sick. We're going to get sick. So I want to thank you. Any final words before we wrap up?
Blessings to everybody. I think people should be working on this as soon as possible, because as these sectors open up, if you wait too long, you sort of lose the competitive field, because other people will be developing these and will be opening up. So you want to jump on it as soon as possible. Read these things. If there's questions, you can ask questions. You can ask the health department. I'm not an expert, but if people have questions, they could ask me questions also.
That's awesome. This has been phenomenal. Listen, you are tuning into the special session with Dr. Camille Jones. We were talking about all things reopening. If you're watching us on the recap, we really want to say thank you for checking us out. Okay, the African American Chamber has pivoted to the virtual space, and I give a lot of credit to Dr. Camille Jones for helping us push to doing that. There are a lot of advantages. There are a lot of great things that we have happening because of it. And if you have not checked out our calendar, please go to www.african-americanchamber.com, okay, and check out our resource items, okay? We will have these resource items on our website very soon, okay? So if you're tuning in right away, they may not be right there on our website. However, they are in the caption below, okay? So be sure to check that out. Thank you guys for tuning in. If you need to get connected with Dr. Camille Jones, I will connect you. So my email is below as well. Reach out to me. I will put you in contact. Listen, if you have not met Dr. Camille Jones and you just heard all of these amazing gems, you won't even be able to guess about all the amazing ideas and things that she has brewing as well, because she's always at chamber programs in support of what we have going. Thank you for your wise words today. And I promise you, we're going to be practicing our best reopening safe space practices, okay? So thank you, Dr. Camille Jones. We'll see you soon.
Thank you. Bye.
Bye-bye.